So as a surgeon, working 10 or 15 years in the past in critical care medicine and emergency surgery, dealing with patients who are acutely ill, and a lot of times these acute illnesses are caused by things that probably could have been prevented 10 or 15 years earlier. The issue becomes that how do you go back and eliminate or minimize these issues that happen to these people to prevent them from getting to the point where they need emergency surgery to be fixed? And I think the biggest thing that we saw over the last 5 or 6 years is the COVID epidemic. And that epidemic taught us a lot. And what we were seeing especially is a lot of the people that were in the ICUs that didn't make it through were mostly men. And if you look at the statistics nationwide, worldwide, it's men that were having the biggest problems. Why was that? There were some limited studies that brought up the fact that maybe the testosterone was lower in some of these men. That's why they were having problems. So a light bulb went off at that. But there's more to it. You know, the majority of people that are passing away were also morbidly obese, which has to do with our diet and our activities. And so much is being missed. So when you see these things, you realize, I never want to see that again. We need to go back to the beginning, figure out where we've gone wrong, get back on the rails, and I think the first thing to do is get the hormonal balance fixed, and that's really our foundation for everything else to fall into place. It's not a magic pill, it doesn't fix everything, but it's a start, and I think that's what gives us a solid foundation to work from for men's health. If what I'm saying resonates, I encourage you to go to petermartin.com. Let's work together to optimize your health. Fill out the form, and my team will get back to you to get you into the office. You can fly in, you can drive in, just come in and see me.